I am Professor Minotti. I am MD and oncologist, and I teach at the School of Medicine of the University Campus Biomedico in Rome. Basically, what we do, myself and my collaborators, we have preclinical research in the lab, and we have clinical pharmacology research in the hospital. Actually, I am also head of the clinical pharmacology unit in the lab. Pharmacology is a cut across discipline, so we interact a lot with oncologists, hematologists, cardiologists, and biochemists. So it's fun. It's a lot of activities. Yes, we have a long-standing interest in anti-cancer drugs. And in particular, we have been a sort of pioneers in the field of cardio-oncology. Cardio-oncology is a discipline that puts together the efficacy of cancer drugs and the risk of cardiovascular complications induced by oncologic treatments. And this is something that we explore in experimental models and something that we also explore in patients, either in daily clinical activity or in clinical trials. So what we do, we were national coordinators for a phase 2 study that explored the efficacy of a new drug to prevent or mitigate cardiotoxicity induced by anthracyclines. Anthracyclines are very widely used drugs that you can use to treat breast cancers, lymphomas, and leukemias. Next, we did a lot of work on interactions between antifungals and anti-leukemic drugs because the antifungals can cause elevations of anti-leukemic drugs in the plasma of patients, and such increases can cause cardiotoxicity. And now we have a new trial starting in a few weeks with the last generation anti-leukemic drug. Yes, I am a member of the Italian Society of Pharmacology, Italian Society of Toxicology, the American Society of Clinical Oncology, and the International Cardio-Oncology Society. Actually, I am an honorary member of the International Cardio-Oncology Society because due to my work with anthracyclines, I was one of the very first Italians to do this kind of discipline. Well, I will say in a very few words, to be a citizen of the world. Once you belong to a scientific society, you are in the best position to intercept unmet medical needs, to foster new research, to develop collaborations. That's the only way you can be in the scientific arena nowadays. You can't be a standalone anymore. You have to be part of a community. A few years ago, I collaborated in drafting and eventually publishing guidelines or position papers in the field of cardio-oncology. And because very many new drugs, very many new cancer drugs are very effective, but the therapeutic index is the distance between efficacy and toxicity, okay? And sometimes this therapeutic window is slim. So you have to educate people to exploit drugs at the best of their efficacy while also minimizing the risk of toxicity. And this is very challenging, but at the same time, it's very instructive. And doing this work, for example, put me in the position to change the schedule of few cancer drugs changing the dosage, changing the timing of administration. And now we have very many patients being treated with new regimens that actually were suggested by me and other colleagues, all belonging to a scientific society. What really impressed me about Karger, first of all, was the number of editorial activities, publishing activities they run. Karger really enjoys a portfolio which is very impressive, very portfolio of journals and book series, which is very impressive. And second, in visiting them in Basel, I had the impression of a very well-structured company with a sort of an industrial attitude. And when I say industrial, I'm not referring to financial outcomes, of course, but I'm speaking of structure, roles, input, outputs. And that was very impressive to me. And probably that was important for me to change my mind and eventually to accept the role as editor-in-chief. I would like to make the journal a journal that publishes original papers, but also a journal that is perceived by the scientific community as a sort of a fireplace to exchange ideas, discuss, to pick on pitfalls and the nice things of the articles published. So basically, what I would like to do, I would like to have chemotherapy publish papers, but also receive letters to editors, commentaries, or collections of opinions. And when I think of Karger, I think of tradition. Karger has been in science so many years now, and they really know what science is. A tradition is something that should always reassure others when they submit the paper, because tradition means dedication by editors. Tradition means that the editors are going to work with the authors to improve their work.